Okay, my patient's name is Sharon Anderson. She's a 66-year-old African-American female. Her chief complaint is of double and blurry vision that started after she got consciousness after having a stroke. She's been wearing an eye patch over one eye, alternating the covered eye to relieve doubling. She also gets dizzy upon moving and is uncomfortable with movement of objects in her peripheral vision. With her medical and ocular history, she has some hypertension, recent CVA, and she doesn't have any diabetes, cancer, or inflammatory conditions in her family history. And she does have a history of blindness and potential glaucoma, and the family has had cataracts. Findings in the eye exam with her right eye corrected, she is 20/30 minus 2, left eye corrected, 20/40 plus 1, and 20/30 minus 2 OU with correction. The cover test, we found that she's 4 diopters right hyper at a distance, and at near she's 10 exophoria with 8 diopters of right hypertropia. In the EOMs, her range of motion was decreased in the right eye upon inferior gaze, full in the left eye, and with both eyes together, she had a right hypertrope that it increased in both eyes, and she did have pain in her upgaze and diplopia in the upgaze. Pursuits, they were jerky, multiple losses of fixation, and she did become dizzy, but the dizziness improved with application of a binasal sector occlusion, so kind of some nystagmus findings there. On NPC, she was unable to make it single with her glasses on. We added 4 diopters base down over that right eye, and she broke at 10, recovered at 15 centimeters. Convertation fields were folded finger count, both eyes. Pupils 5 and 3 millimeters, both eyes, and perla, no APD, ODOS. RET findings were plano through her habitual RX. Adnexa was all clean and clear. Lids and lashes and meibomian glands, positive stasis and negative debris, both eyes. Tear films was tear breakup time was 5 seconds, both eyes. And a trace injection OU on the conch, sclera white and quiet, cornea is clear, negative edema, iris is flat and hazel, both eyes, pupils had normal borders, anterior chamber is deep, negative cells and flare, lens is trace NS, and IOP was 16, right eye, 17 left eye. Vitreous is clear, optic nerve is rounded pink, with cup to disc ratio of 0.5 to 0.45, ODOS, NICO is flat. The vessels had about a 0.6 AV ratio with negative attenuation. Did have a trace copper wire appearance in both eyes. Posterior pole was unremarkable. Periphery, no holes, breaks or tears, no neovascularization, scarring, or other pigment changes in both eyes. So my findings today on that exam indicate some vertigo. What I'm going to do with that is refer her to an audiologist. I just want the audiologist to perform some tests in regards to her dizziness, so that you can kind of determine if that is peripheral or ear level, central, or kind of no position with that, and have her do like a VNG test to evaluate Sharon further.